going to be a demonstration on the blood transfusion, and I'm going to demonstrate that for you today. First of all, what you want to do is check your doctor's order and make sure that you do have an order for a blood product, and in this case I do. Doctor has written infuse 1 unit of packed RBCs, and I'm going to go ahead, check my order, it's there in the chart. I'm going to check and make sure that there's a type of cross match on the chart, that it's less than 72 hours old. At that point, I'm also going to check and make sure that the patient has signed a consent form for the transfusion, and they have. I have that in my hand. And I'm going to go ahead and kind of wonder why this patient's getting this blood, this unit of packed RBC, so I can go back and check the CBC. Maybe their H&H is low and they're having symptoms. They're pale, short of breath, and their oxygen saturation isn't the best. And doctor wants them to have a unit of blood. So I've done all that and verified everything. At this point, I'm going to go into the patient's room, wash my hands, and I'm going to go ahead and check 2 forms of ID and make sure it's the correct patient, and it is. Are you my type? Date of birth 1956. And are you my type? Hi, I'm Mrs. Harto, and I'm going to transfuse a unit of blood today. Your doctor has ordered for you. And at this point, the patient might ask you questions of why they're getting the unit of blood, so you want to go ahead and explain what's going on, why it's been ordered for them, etc. I also want to ask him, do you have any allergies? And in this case, we're going to say that he's told me that he does not have any allergies, but if a patient does have a history of a lot of allergies, you might be a little more suspicious that they might have a reaction to the transfusion. I also would like to ask him if he's ever had a transfusion before, and if he has he ever had a reaction to a transfusion before? So them are all important pieces of information to collect. At this point, I'm going to go ahead, I'm going to put gloves on and start my assessment. I'm going to take vital signs. I'm going to make sure temperature is within normal range before I even hang the normal saline. And I'm going to go ahead and check the patient's IV site. And they do have an IV saline port in their left anapube area. It's a number 20 gauge, and we can use a number 20 or a number 18 gauge catheter, so we're good there. The next thing I want to do is I brought a flush with me, and we need to flush it and make sure it's patent. So I'm going to go ahead, take my alcohol wipe the access port, take my cap off the flush, go ahead and connect, aspirate for blood, and just instill a couple milliliters of normal saline. Make sure it's patent and relock it. Okay. So his IV saline port is good to go. It's patent and it's ready to be used. At this point, I want to take my stethoscope and I want to do a pulmonary assessment. Make sure I get a good baseline lung sounds. And currently his lungs are clear and we should be ready to go. So I'm going to go ahead and I'm going to collect the materials that I'm going to need. Normal saline, and I'm going to need a blood administration set. The blood administration set might be a little different. It differs in all different facilities, depending on what kind of IV pumps the facility uses and whatnot also. And because we're only transfusing 1 unit of packed RBCs, what I'm going to do is probably use a 250 milliliter bag of normal saline. I have my blood tubing, and there are 3 actual roller clamps. And the next thing you should do after you open your blood administration set is to close all your roller clamps, okay? And I'm going to go ahead, spike my normal saline bag, okay, with one side of the Y arm of my blood administration set. Okay. Go ahead, pull this off. Okay, in it goes. All right. this point, I just wanna hang it on my IV pole because it's easier to let it hang there than me try to finagle 600 things in my hands. And what I'm going to do is I'm gonna go ahead and prime this administration set with the normal saline. So I'm gonna open the Y port, the Y clamp, on the Y side of the normal saline that I spiked. I'm gonna loosen the end of my IV tubing, so make sure that it can breathe. Okay, so while I prime it, and I'm gonna go ahead, first of all, and I'm gonna fill the chamber in my blood administration set. I'm gonna fill it so the normal saline comes just above the inline filter in that drip chamber. And that's because I don't want, once I spike the blood bag with the other Y port of my Y arm of this blood set, I don't want the top of this inline filter to be exposed, because then it means that when my blood starts, my red blood cells are going to hit the top of that and it's hard and they're going to break. I don't want that. So that's, normal saline is above the inline filter, and I'm going to take my roller clamp from down below and I'm going to go ahead, open it up, and I'm going to go ahead and prime the tubing. Okay? Okay. At this point, I've still kept the end of my sterile cap sterile, and I've already flushed the IV site, so I can go ahead and I can go ahead and just hook this to the IV site. I might have to wipe the excess cord again with the alcohol prep. Okay. Unlock the Y side, the actual slide clamp of the saline lock. And I'm going to start this running at KVO rate. So that's about 25 milliliters an hour. Now, if I had an IV pump, I could just put it on the program 25 milliliters on the IV pump, but I don't. This is gravity, but I have 10 drop tubing. So if I use my magic number, which in this case is going to be 6, then I could take 6 and put it into 25, and I'm going to get 4 drops a minute, approximately 4 to 5 drops per minute, which means that's about 1 drop every 15 seconds, okay? And that's pretty slow if you think about it, so that can be a little difficult to do also. But what I want to do is, this clamp I want to leave alone. I'm going to regulate the flow with the lower roller clamp on the main tubing. I'm going to put my watch just behind the drip chamber so I can see the drips, and I'm going to start that going just at a very, very slow rate, just enough to keep the vein open. Okay. Alrighty. So that's running at KVO rate. I've been notified that the blood is ready in the blood bank, so I'm going to take my requisition form and I'm going to go to the blood lab and I'm going to pick up my unit of blood.